February was Heart Health Month, and it got us thinking here at NBC4 today. A recently released report showed that women are very likely to ignore signs of heart disease. One of those women who took notice, our producer, Cindi Remy. And this morning, she takes one of several simple tests that can give you an answer on your risk.
My name is Liz, Cindy, and I'm going to get you registered.
Okay.
This is Cindy, a mother, our friend, and our producer who also has a family history of heart disease. She's registering for a calcium score here at the McConnell Heart Hospital in Riverside. Dr. Kanny Grewal will oversee the procedure and her results.
It's the first non-invasive test that doesn't need a catheter or anything like that, that lets you actually take an image directly of where heart disease is starting.
The cost? Only $95.
All right, and we're all set here, and I hope everything goes well with you.
Yeah, me too.
Hi, I'm Wendy. I'm ready to take you back.
As she walks through the hallways that so many heart patients do, her heart rate goes up. We find that out as soon as she gets hooked up to this machine.
I'm very nervous. I thought at first this would be a good thing, and I'm sure it's still a good thing, but I didn't think I'd be this nervous.
She's nervous because...
Family history of heart disease?
Yes.
What kind of family history?
My dad had 2 heart attacks within a month after his 56th birthday.
That's pretty young, yeah.
And my grandfather dropped dead at the age of his early 70s.
But she's hoping this scan, these machines, will clue her in to some small chest pains she's had over the past few years. After removing any metal jewelry, she's in place for the test.
You're going to hear a woman's voice come over the intercom. She's going to tell you when to breathe and when not to breathe. Okay, we're going to get started.
Take a breath in and hold it.
Basically, it's looking at the arteries of the heart, literally inside them, for early signs of plaque buildup.
They're looking for little pink dots. Dots would indicate plaque buildup.
Right here is her right coronary artery, and there's a little speck of pink right in that particular artery.
They found something. In less than 10 minutes, the calcium score is done.
Okay, if you want to go ahead and bring your arms down by your sides.
Dr. Grewal goes over the results with her immediately.
The good news we're seeing here is that basically there's really no evidence of any significant plaques anywhere in these arteries.
But the scan did find that one small spot in her right coronary.
It's very, very unlikely that plaque would ever cause any kind of problem over, say, the next 20 years.
Still, beyond family history, Dr. Grewal wants Cindy to work on reducing other risk factors so this little speck doesn't become something a whole lot bigger.
Work on the smoking, which clearly over time, can lead to heart problems.
Weight.
Sure.
He sees too many patients who have a good scan like this and ignore it.
The problem is that if the patient gets that result without some education, they can be falsely reassured that everything's fine and they don't need to think about prevention.
Cindy tells us she gets the message loud and clear.
I have a 3-year-old, and I don't want my son to lose his mom at a young age. So I got to do something because I don't want that to happen.
So here is what the doctor wants Cindy to do at this point. Get 2.5 hours of exercise each week. And some of that can be as easy as walking at the mall for 10 minutes in that total. She needs to stop smoking, and she needs to get her cholesterol level checked every 1 to 2 years with her family doctor. Now, to see the 4 heart tests you may want to consider if you have a family history or other risk factors, all you have to do is go to our website, NBC4i.com, and search the words heart tests. Mike?
Mikaela